We could all use a little help navigating the news these days. The Consider This podcast wants to give you a hand. 6 days a week, we'll help you make sense of the day's biggest news story and what it means for you in less than 15 minutes. Listen now to the Consider This podcast from NPR.
Welcome. You're listening to another podcast of Mother's War on Violence at 89.9 FM. And I'm your host, Yolanda Wallace, and we have an exciting topic today, healthcare. It is tough to navigate our healthcare system and what are the best options. Today, we have Robin Henry in our studio, the Chief Operating Officer of Solvera Health, with us today. And she's going to give us a few tips about general health care. Welcome, Robin.
Hi, Yolanda. Thank you.
So, Robin, when it comes to health care, can you just tell me a little bit about what you do real briefly, and then we'll go into the rest of the interview?
Of course. At Solvera Health, we are located at 3525 North University here in Peoria. We began seeing patients in October of 2021, so in the midst of COVID, and it's expanded into Galesburg Market as well as Carbondale. But in our Peoria space, it is that comprehensive primary care model. So we have our general providers, we have our family medicine physicians and our nurse practitioners. We have a gynecologist here in Peoria. We have audiology, physical therapy. We have our on-site pharmacy. It's with that intent to make that visit very meaningful and impactful and all under one roof.
Awesome. And what your role is there?
I serve as our Chief Operating Officer. I'm also a registered nurse for about 20 plus years now. So I help coordinate our day-to-day clinic functions within our 3 locations on the operational scope, but also overarching into a lot of our clinic.
Awesome. Thank you, Robin. And then when it comes to Medicare, Medicaid, I know that can be a challenge. And do you want to expound on those
Sure, I'd love
things?
to. There's always challenges in healthcare that obviously we'll always need help with navigating this course. There is our safety nets, so that is with our Medicaid and our Medicare services because it's sponsored by the federal government. There are challenges, though, when it comes to eligibility. There's challenges when it comes to what our health spend looks like. There's challenges to those persons who are right at that threshold where they need the federal services, for example, Medicaid, if they're not 65 and over, but they can't afford their employer-sponsored health plan, and yet they still make too much to also receive the federal benefits.
Okay.
So there's a lot of little tricks,
In between the gaps.
In between, yes. And Solvera Health, we are a federally qualified health center as a lookalike, and so what that means is we're also considered into the thralls of healthcare. We're there to help navigate. We're there regardless of ability to pay. This person is going to receive the appropriate health care that they need, and we try to orchestrate it as so it's our place. You know, it is during our clinic appointment. You know, we try to encompass that level of care to avoid, if it is not life-saving, of course, life-saving measures always go to the emergency room. But what we can do to try to decompress those emergency room visits by incorporating the care within our primary space. And the government looks favorably upon that because it helps deliver that high-quality care at that lower healthcare cost.
Okay. Awesome. So you answered my question about how it affects the low income and what resources are there. And I'm glad that, you know, we have some healthcare services within our area who help people who are,
Absolutely.
you know, not able to pay and that are low income, or sometimes they're, like you said, in between the jobs and not making enough to pay, because health care is getting quite expensive nowadays. And what changes can we expect in 2025 with our new president?
There are some changes coming from an operational shift, you know, as well to encompass the overall patient care. You know, as we're going into our next presidency, the Affordable Care Act is already in action. It's Obamacare. But it sounds as though President Trump is really going to look at how to restructure that. Looks like the avenue is going to come to that end in 2025, and then what are the next steps? There's going to be a lot of policy changes around cost of care, introducing alternative solutions. So our persons, our public, our low income, our seniors, our families in these rural communities don't have to think food or medicine. So I see some positive in the windshield view, but I also have some hesitation just because what is that going to look like for changing coverage as well as eligibility? I've read that there's going to be short-term insurance coverage plans, like a skinny plan, I believe is what they are starting to kind of call it. But I also can see that they're forecasting reproductive health changes, and especially in the LGBTQ policy changes and coverage to care. So, yes, I can see a lot of good, but then I also have a lot of worry.
A lot of doubt. Not doubt, but like you said, a lot of worry. For sure, we're expecting some challenges next year. And I don't understand how come every time we get a new president, we have to change.
Brings new audience.
Yeah.
And then you have your sides of the election. You always want to come in and reframe what was built instead of it was working fine, to kind of leave that alone. But I can still appreciate, that magnifying glass, really looking to see how to make things better. We do have an aging population, and, with our baby boomers, and we do need that coverage.
Yeah, our baby boomers are the ones that are a lot of our nursing home patients and stuff like that.
Yeah, very much. I mean, and then they have conversations around privatizing, what our healthcare looks like, but that could introduce more of that out-of-pocket cost with less coverage. So there's a lot of separation, but yet strengthening that I can kind of see happening.
Okay, and then I read something in the 2025 book. Is this really going to happen? Well, some of the stuff I read is already happening now. So what's supposed to be new about the 2025 other than what we've already discussed?
I think they'll find another page and turn it, and it will just continue to, change a lot of what we've already implemented. And, honestly, I think it's okay. I mean, you've got to be innovative and be able to have those out-of-the-box solutions. And if it is complementing policy change, then all the better.
Okay. And then I forgot to ask the ages of people that you serve at Solvera Health.
Sure. We all the way down from, when a mom is pregnant, we have pediatrics from newborn on up and all the way up into our aging population. So we really encompass that family medicine in not necessarily separate specialties. For example, pediatrics. We want to see the patient through the trajectory of our care. We have our providers who are also aging with their patients. And to me, that's remarkable because they know the stories and they know, what got them to where they are today.
Awesome. That is so true. That's because of the long relationships and that they've established in there.
Well, that's a primary care agenda.
Right.
We want to be that first place.
And how's this, I don't know, how's this going to affect the health care costs?
I think that's yet to say. Looking at it on a Medicare scope, there's a lot that primary care does into that space. Again, as our persons are aging, everyone in healthcare, we're becoming that much smarter, and it's kind of allowing the population to live longer. But there's still things we have to mitigate, chronic conditions. With our Medicare population, heart disease, diabetes, and obesity, you want to maintain that continuity of care. And that is one of my worries with changes with the new presidency into 25 is what is that going to look like? Because if there's a lot of new adoption into new models or into new insurance plans, what is that going to look like for coverage? Is it going to be disruptive or is it going to maintain? So I kind of have hesitancy towards that, just as well as with Medicaid, because what is going to change? You have your population, Medicare, obviously 65 and over, but it's also anybody with a disability at any age. And you have Medicaid. There's 80 million people in the nation that utilize Medicaid for the doctor visits, hospital stays, home health, nursing facilities. That also encompasses 20% of the health spend. So there is a lot of concern into what that looks like, because it's not going to get cheaper. What we do for ourselves outside of the medical facilities is really what's going to do it for cost.
And I heard you mention about one of the services you provide was the pharmacist, and we know sometimes it's kind of hard to get medications these days. Can you speak to that? What's the deal?
Yeah, there can be a lot of challenges with medication. Insurance providers, they want what's called a formulary. So they want, here's the medication that we will cover. It's usually an alternative to a brand or to a generic. But at times it can limit it secondary to prior authorization. So you have to have completed the bullet points up to maintain that coverage. And I am very proud. Our pharmacy in Peoria, with our pharmacist in charge on site, there's a lot that we've been able to do to really cut into that cost. Great example of a patient we serve, low-income aging individual, was paying $114 out of pocket for years. And we've our pharmacist has built our own savings card, our Solvera Health savings, very similar to a Good RX. But was able almost 80%, really just drop down what that out-of-pocket occurrence looks like. And so end of the year, our Galesburg telepharmacy will be live. So it's pretty exciting for us into this market.
Oh, yeah. Awesome. And then I was listening to you talk about transportation. What are the requirements to get the transportation?
Oh, sure. To come into our clinic in Peoria, we do have a transportation service. We have our little minivan. It is wheelchair accessible. So we are able to pick up, drop off patients within the Peoria vicinity, close into the War Memorial and University intersection. But we also, going back to pharmacy, we also will partake in medication delivery into Peak and East Peoria. Washington,
surrounding
Peoria.
areas.
Yeah, just the surrounding areas. We try to, because we know that's a big gap into the prescription coverage as well, is that accessibility and, how will you get it to be able to take the medicine? If I don't have transportation, I can't go and get it.
Of course.
So we've really elevated having that service and helping with the adherence and education.
Right, and I've been to Solvera a few times, and I see that it doesn't matter what your income is for you to get that transportation. Your car could have broken down, or you just don't have a vehicle, and you're already scheduled, and they all coordinate with the appointment as well as, to get you to the appointment on time, blah, 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 right?
Yes, and you'll have great conversations with Felton.
Oh, yeah, that's right. Okay, and then let's talk about a little bit about our partnership with Mothers War on Violence and Solvera Health. This year we launched our very first healthcare fair, and we were excited, and that was in August.
Yes.
And you guys came out, and we went to an area in our city where healthcare and grocery stores, it's a desert, and there's just not that much resources down there.
Absolutely.
61605.
Yeah, we have three of the most vulnerable zip codes, with 30405, and to be able to partake in that with other non-for-profits, it's very humbling and very rewarding. And I'm a huge believer in taking our healthcare out of our own brick and mortar and going to where these persons are, because there is such a gap in such a desert, and that's something you really can't ignore, and it is a human right to receive this health care. So to me, being able to partner and be visible is second to none, and just being able to forge those relationships and to have that presence, but you have to continue with the promise you're forging. And I feel that we really do that in spectacular venues, between, Mothers Against Violence.
Mothers War on Violence.
Thank you. Mothers War on Violence. But, with that and encompassing, down with House of Hope or wherever, we might partner with, it's just around that access to care.
Yes. I think that's the reason why we all do it, just to make sure that they have access to options of different resources that are in our community, and not just being stuck to just what's there.
Oh, 100%. And then when you look at our zip codes, and we partner with our community healthcare entities as well. This is this is not our own track we're on. We do partner, with Heartland Health Services, and we partner with Carl Health and OSF and the other entities, as well as specialty services. But it's getting down to the core and finding out what's needed, and it's just really diving into it, but committing.
That's so true. And so in the future, we look forward to having more resource healthcare fairs or something along the line of 2025, as well as we had a presentation with our partnership with Ameren, Illinois, with the Healthier Homes Initiatives. And I am excited about, as the executive director of Mothers War on Violence, that we are able to get them signed up. You want to talk a little bit about that?
Oh, absolutely. So Ameren has
Yes.
brought forth this great innovation, project around the efficiency and the energy within the homes. And as our talks continued, it was how to identify, persons that needed this, because it is a way to have a healthier lifestyle. And so, we have these little prescription pads, I'll call them little notepads, but it specifically will say, talk to this patient. I believe that secondary to a chronic condition, maybe heart failure or lung disease, or even if there's children under the age of 5, that have this exposure and this potential for prolonged illness, what Ameren can come in there and do. And, we've got a recipient now who's just over the moon with, with the services that are coming, because I think a lot of it they didn't know it was available. And then, and I'm so curious to see what this outcome looks like, what these changes, how they do impact health. So I think it's a great agenda. It's great.
It is. And even the monitor that they give you to monitor the clean air in the area. So the whole purpose for the program, this new pilot program, which they've launched with Mothers War on Violence, is just to make sure that we meet the needs of those unhealthy breathing conditions that are happening with our, with our families, especially those, with breathing conditions. Because when I look at all the things that they're going to do, and if you fit the income guideline, then, you could basically get your whole house just, very easy to breathe. Everybody has these breathing, what are they called? Humidifiers.
Yeah, the air purifiers, like all that. But you've just got to get right into it and really change it out. But then it comes down to who can afford it.
Exactly.
And having this as that resource, it's it's a other thing. You don't need that provider order, but it's just nice to know it's encouraged, and it's the providers are able to really see it and know that they can be a part of this, by introducing the service to patients that we serve.
Just with the referral form, which I think is awesome. And then I get to sign up some of those people.
Yes, you do.
So
Every Wednesday.
Every Wednesday or every other Wednesday. So I'm excited about being a part of that. And then the Medicare thing, and just learning about having to be 65. Now I'm doing my SHIP training and everything, and with Colin and everything there at Solvera Health. And I just wonder, why do they start calling you at 60 and you're not even, or 55 or 59 and you're not even 60 yet if you don't qualify for Medicare until 65?
I think it's a proactive planning.
Yeah.
I don't think anybody under 65 wants that AARP in their mailbox, because they know it's creeping. But I think we all know someone who's aging, and I think we all know someone who could benefit from, that service. Medicare covers majority of healthcare within Illinois. If without it, there'd be elderly without healthcare. Those that are most vulnerable that absolutely need it. I've met people that we've taken care of that are on that 65 threshold who haven't yet found a plan that fits. And my first takeaway immediately is just start with the traditional red and blue card, that way you can at least get this health care that you're awarded. You've paid into it your entire life, kind of use it. But Colin Cusack, he is on board with us at Solvera Health, and he's kind of that touch point, and he can help and introduce a plan that fits, and is really mindful into considering what that cost of care is. So knowing what is out of pocket. Now, mind you, he does not get anything into our documentation or charts because of HIPAA. Right. It's just conversations. But when he's told, like, oh, I'm paying $400 out of pocket, you can just kind of see his eyeballs bug out.
Right.
And he wants to do what he can to minimize that cost without changing medication. And so that's where it comes in twofold, because we can get the help with our pharmacy.
Okay, that's right. So Part A is, let's see if I can get this right, Robin. But Part A is where the hospital pays for that part, right?
Correct. Your hospital, your skilled
Are you
Stay after
skilled
hospital,
state?
correct.
And then Part B is where they pay for the medications while you're at the stay. Outpatient.
is Medicare B.
That's right. Okay.
So like your primary care facilities, your clinics, sometimes depending on hospitalizations, but therapy in the home or home health in the home.
Right.
Because it, depending on the stay and the dates that run into fact. But yeah, so Part B covers anything like out of the hospital.
Yeah, that's what I'm saying. Out. Okay, so Part B is out of the hospital. Part A is in the hospital. But can't Part B pay for some medication? No, that's Part D.
There you go.
There we go.
That's Part D.
Part D is who pays for the medication. So, and as I've learned a whole lot about this Medicare, Medicaid thing, I just find that it really is a good program. But everybody thinks, like Colin Cusack said, everybody thinks that when you get Medicare, the things are supposed to be free.
Don't we wish? No, there still is
A cost.
your out-of-pocket cost. There's still, you can still run into that donut hole. You know, there is still a cost, but I think the mindset that it is there to help and at least diminish maybe, you know, that 80% and you only have 20% out of pocket, it does change the way you kind of process it, because it still shows that this healthcare is available versus going without. And then I think bringing in additional charity or additional maybe grants, for example, or by incorporating clinics such as Solvera Health or even our Heartland Health services here in Peoria, that is also a federally qualified health center. You know, it's really just engaging into those services that are here under the federal government to help and to support the persons.
Awesome. Well, thank you so much, Robin, for joining us today on our podcast on Medicare and Medicaid and the healthcare system and everything else that we've discussed.
Happy to.
Thank you, and Mothers War on Violence looks forward to working with you all again in 2025. Thank you.
Thank you.